Hi, it's Tracy. It occurs to me that I talk about gestational diabetes and diabetes in pregnancy all the time on the channel, but I don't know that I've ever told you exactly in very simple terms what it is. So in this video, I thought I would do just that, talk to you about what gestational diabetes is and how it can affect your pregnancy. Developing diabetes in pregnancy makes sense in a way because your body wants to have the blood glucoses a little bit higher so that it can slide downhill to the baby. Glucose crosses the placenta pretty regularly, so baby's glucose at any given time is going to be about 80% of whatever your blood glucose is. One of the things that happens in pregnancy is that the placenta makes hormones that make your blood sugar a little bit higher. And I think historically that's just so that glucose has an easier time getting to the baby. And this is your body's way of ensuring that the baby has enough nutrition and energy. 100 years ago, gestational diabetes was not a thing. There was more food uncertainty, and today most of us have all the calories we need. It's everywhere we go, especially processed foods, and as a result we have too much of a good thing. We have too much glucose circulating, and our body's system of making sure that babies get plenty of nutrition in times of starvation or famine just overproduces, so that we have these counter-regulatory hormones, these hormones that are produced by the placenta that make our blood sugars a little bit higher so that we can give all the glucose we have to the baby. Now we have too much glucose circulating, so our blood sugars are too high, and that makes our baby's blood sugars too high, and that leads to a chain of events that's harmful for you and your baby. You'll be tested for gestational diabetes at about the beginning of the 3rd trimester, and we choose that time for the most part because glucoses tend to go up as the pregnancy progresses. The placenta gets bigger, it starts making more of these counter-regulatory hormones, and so your blood sugars go up. The best time to try to catch gestational diabetes is about between 24 and 28 weeks, just when you're getting ready to start the 3rd trimester. It's early enough so that we have plenty of time to treat it, and it's late enough in the pregnancy that we're more likely to detect it since those blood sugars go up over time. Most of us test for diabetes by giving you glucola, which is a really sweet syrupy drink that not many people enjoy. We test your glucose 1 hour after you drink 50 grams of glucola. And if your blood glucose is more than 140, or some centers use 135 or even 130, then you come back for a 3-hour glucose tolerance test, which is the definitive diagnostic test for gestational diabetes. If your testing is abnormal, if your blood sugars are elevated on this test, then usually you are diagnosed with gestational diabetes and you get sent to a specialist like me, or some centers use a dietitian, or some centers use diabetes educators that they have as part of their practice. Any way you get educated and you begin your journey as a gestational diabetic is going to be fine. Look for all the information that you can, and remember that we want your fasting glucose in the morning to be less than 95. 1 hour after you eat, it should be less than 140, and 2 hours after you eat, it should be less than 120. So you'll get a meter and you can start checking your blood sugars with finger sticks at home, and your provider will tell you how they want you to check your glucoses. Some people check fasting and then 2 hours after meals. Some centers will have you check fasting and 1 hour after meals. There's no one right way to do this, so check the way your provider tells you and just try to fit within those guidelines. Remember that the mainstay of therapy for gestational diabetes is the diet. It is all about what you eat, and food is a very powerful medicine for better or for worse. Eating the right things in the right combinations, in the right order, at the right times of day can make the difference between success and failure when you have gestational diabetes. The majority of people who have gestational diabetes are able to keep their glucoses under good control just following a diet. Sometimes, though, medication may be required. So your provider may talk to you about starting an oral medication like metformin, or they may talk with you about starting insulin injections. That can be a kind of scary thought, but remember that this is usually temporary and that most people have diabetes resolve after they have the baby. But one thing to remember is that about 60 to 70% of people who have gestational diabetes during the pregnancy go on to become diabetic. About 30% of women may already have been diabetic and it was just unmasked by the pregnancy. So that 30% are going to stay diabetic after they have their babies. Another 30% of women will become diabetic within 5 to 10 years. So that adds up to about 60 to 70% chance that diabetes will stick around or will come back to haunt you. So how you manage your diabetes in pregnancy can help determine what your risk will be of staying diabetic or becoming diabetic. Thanks so much for watching today. I'm excited to tell you that I'm introducing a course in September on conquering diabetes in pregnancy. It's going to have great information about nutrition in pregnancy, how to manage your exercise and your meal planning and everything else that you would want to know about gestational diabetes. For now, head on over to the blog to get more information about healthy ways to eat in pregnancy. I've got a free guide for you. Go to drtracypapa.com/diet guide for more information about how to eat healthy in pregnancy. And when you sign up, you'll be the first to know when the course comes out.